problems that major public health and health policy issues that we're struggling with. I just wanted to give you kind of our North Star of the Center for Chronic Disease. Our vision is to create a world where healthcare research and policy seamlessly interact to improve the health of individuals at risk for or living with chronic diseases. And to meet that vision, which is in some ways a dream for some of us, we set out to develop and study innovations in care, and then to influence policies that affect the financing of these effective. So I wanted to, today's event is, and welcome to all of you who are on Zoom, and there's a full audience here in the room as well, here in the Warden Center. And today's event was actually organized by one of our affiliated faculty of the center, who I want to introduce today, who's going to moderate today's session. She played a key role in organizing and inviting all the speakers. And that is Anna Volerman, who's Associate Professor of Medicine and Pediatrics. She studies innovations in medical education and healthcare delivery. And she moves sort of seamlessly between clinical settings. Please mute if you're on. We're really lucky to have Anna here. She not only works in the clinical setting, but she works in community settings like our schools and does research in our public schools. And I want to do a few housekeeping things. So there's a door at the back of the room. So if you need to go in and out, please use the back door, not the front door, to not interrupt the speakers. I also want to end by actually really thanking the people that put together this event. So I want to thank all the volunteers that man the front desk. And I want to thank all of our volunteers, Irene Shao, our communications manager, Rachel Janke, our administrative director, and if you have not seen her name, the most important person that organized the symposium, Mary King. So if you see Mary King, I'm going to pass this on to Anna Volerman.
Good morning, everyone. It's really great to be here, and it's an honor to welcome all of you to the Center for Chronic Disease Research and Policy Annual Symposium. This year, our symposium is focused on the important topic of mental health. As a primary care doctor for both adults and children, it is an issue that I've personally witnessed on the rise. I was just talking with one of our speakers. I always run late in our primary care clinic, and yet over the last couple of years, I have increasingly run more late than usual, and typically it's related to topics of mental health that come up among our patients. I know that I'm not alone, as reflected by the fact that the U.S. Surgeon General declared a youth mental health crisis in recent years. As background, youth mental health has been worsening for more than a decade, with a 40% increase in the number of teens reporting a rise in the feelings of persistent hopelessness and suicidality. According to the CDC, 1 in 5 teens in our country has seriously considered suicide, and 1 in 10 has attempted it. Today's youth face unprecedented challenges: the negative effects of social media, the greater academic pressures, the burden of childhood traumas and traumatic experiences, as well as higher rates of alcohol and substance abuse. And this is all on top of the social issues facing our country, from racism to gun violence to climate change. The reality is that the pandemic only made things worse. As young people lost parents and caregivers to COVID, as they face economic stress as they watch their caregivers lose jobs, and as they lost access to the safety net supports and services provided by schools. Further, the alarming mental health symptoms have been exacerbated in groups that experience discrimination: girls, LGBTQ plus youth, and teens targeted by racism. The reality is, while we're standing here in the US, this is not a US problem, it is a global issue. Now, as someone who takes care of both adults and children, I know that youth mental health challenges affect everyone, not just the children and the adolescents, but also the parents, the grandparents, the teachers, the social workers, and all of the members of the community in which they live. In our clinics and our communities, we're seeing higher rates of depression, anxiety, trauma, post-traumatic stress, which often presents in the form of behavioral problems, right? Most kids don't show up and say, I have depression. Most kids are acting out or hanging out in their rooms more, etc. But we also see the parents and the community members who are struggling to understand what is going on, how to help, and really how to navigate our very limited mental health care system. Now, more than ever, it is time to put mental health in equal footing with physical health. We must advance mental health care and policies that make it easier to screen, to diagnose, and to treat this problem, to support the youth who are really our future. Today, we're thrilled to have an amazing lineup of speakers who will share their research and their perspectives on adolescent mental health. And I hope it is just the beginning of a very important conversation among doctors, researchers, clinicians, parents, and members of our community. Our event today also includes a poster session and a lunch, which I hope you'll stick around for, that gives us an opportunity to share knowledge and form new partnerships and collaborations. I'm excited to talk together, to think together, and exchange ideas together. And I'm grateful that we're convening today to together make an impact on this mental health crisis.